sure? All right. So today's Monday, and Monday is topic of the week or trend or state of the industry. And I was going to do a study today, but I thought, you know what? Since in the United States, we just had a healthcare bill that was going to change healthcare again, and it didn't pass, or they pulled it, or whatever they happened to do. And a lot of what happens in trying to solve healthcare is not solving the right problem. And why you're still suffering with back pain is kind of the same problem. So I'm going to talk you through how they need to solve the problem of healthcare. And it's going to be also about why your back pain is not any better, because they're kind of connected. It's the system is not working for you. The system is not designed to identify the best solution for you. Why do we do these videos? We do these videos so you have tools. This is about that tool. Doctors, this is the core of the entire conversation today with this video is doctors are not obligated to report their results. They do not have to report what happened. There's one industry, and one and a half maybe, but the biggest one is organ transplant. They have to report their results, because to get another organ to transplant it, you have to have good outcomes, but it's the only industry that does it. So part of the solution for healthcare is competing on outcomes. What is the added value? What is the benefit? We've identified 9 steps over the last 23 years. And along this pathway, we've identified the best outcomes. Why? Why do we do it? We do it because I suffered with back pain for a long time. And every decision I made for myself was, how can I be better? What can I do to be better? That's outcome. I didn't care what anybody else thought. I only knew what was happening with my back. That was outcome. And I was in a lot of pain. And again, this whole solution, we're going to talk about back pain, but it's the entire medical industry. Don't be confused. This is everybody. This is about back pain because we all have back pain. Back pain, the chronic back pain is on the rise, but back pain is the second leading most cause of disability in the United States of America. It's the number one reason for people missing work. Upwards of $200 billion is spent on back pain, and it's getting worse. There's more money spent on back pain than spent on solving cancer. And back pain's getting worse. Since from 92 to 2006, they did a study and they found out it's more than doubled chronic back pain. The back pain that you have that never ever goes away, that's chronic back pain, it's on the rise. The system is not working. So here's how you solve the system, but here's also how you solve your back problem. Number one, focus on the value for the patient. Don't focus on cutting costs. A lot of healthcare is focused on cutting costs. Here's a good example. They need to lower the cost of fusion. Fusion used to be $150,000, and they've lowering it closer to $100,000, in some cases under $100,000. But the goal shouldn't be to control the cost of fusion. The goal is to get the best therapy that gives you the best outcome. Fusion, quite frankly, gives you the worst outcome. And they're focused on controlling cost of fusion. How about you control the problem without fusion? That's basing it on outcome. Competition should center around conditions over the full cycle of care. What does that mean? I call it closing the loop. What does that mean? It means you start in one position and you have to get the problem completely resolved. That's the full cycle of care. We have a study of 60 patients that came into us and they were failed back surgery syndrome. They failed surgery and then the surgeons let them go. Well, did they finish the cycle of care? Did they close the loop? Did the patient get any better? They only got worse. They weren't closing the loop. You got to close the loop. We close the loop. Healthcare has to close the loop. If you have a problem, they have to solve the problem. If it doesn't solve the problem, and if you're not paying for solving the problem, don't do it, and then don't pay for it. High quality care should be less costly. Sometimes, over the long term, an expense in the beginning that's expensive, over the long term is less expensive if the patient has less problems. So what that means is, what is the outcome over time? What is the added benefit of the therapy? How long were they better? Is it temporary or is it long term? If you put the emphasis on the long term, then you don't trip over the dollar bills in the short term. Meaning you spend the money short term knowing that you're going to get an added value long term. That's outcome over time. It's the study that we're currently working on. We had 80 patients. Long-term outcome, they were better. We've talked about that in our case studies. Value must be driven by provider experience. How much experience does the provider have? How scalable is it? What are they working on? You know, a good example is if you're going to get a spine surgery, you don't want to go to a spine surgeon that does one a week. You want one that maybe does 2 or 3 a day. Okay? We have 1,020 case studies. That's what this is right here. And it's all about herniated disc, bulging disc, degenerated disc, stenosis, and sciatica. It's all about the low back. That's all we do. That's all we do. You want to solve the problem? You focus in one area. Outcome teams. That's what we have. We have a team of medical doctors, chiropractors, physical therapists, nurse practitioners, and we all work together as a team. As this becomes scalable, it needs to be implemented across the country. I'm not just talking about our program. I'm talking about the best programs have to be available to everybody. And when they're available to everybody, then again, you get the added benefit. That's scalable. The results of information support the value-based model. What does that mean? If you don't know what the outcome is, and we talked about this in the beginning, doctors don't have to publish outcomes. They're not obligated to publish outcomes. So you do not know what the outcome expectation should be. It's got to be published. It's got to be everywhere. We have, and it's part of why the American College of Physicians had to put out how to treat back pain. Because everybody was doing it wrong. At least they're starting in the right direction, but the system has to be in the right direction. And again, don't be fooled. This is not just about back pain. This is about all the conditions of healthcare. We've published our study. Our study validates outcomes. We're probably the only ones in the back pain industry that has done this. Certainly for non-surgical, we're the only ones who've done this. Why? Because you need to know. And it needs to be a system where everybody has to do it. That's why we have 1,050 now, or up to 1,050 case studies. Again, the goal is going to be 2,000. Has to be published. It's not published. It's hard to find. Innovation, most importantly. Innovation has to be promoted. Sometimes innovation is frowned upon. Oh, that's something new, that's something different. We get that. We're new and different because we affect the disc. You need to promote the best. You can't hold them back. This is the solution for healthcare. This is why your back pain isn't getting better. It's a dirty secret. The healthcare industry is broken and they're trying to solve it by doing the wrong thing. It doesn't matter if the bill had passed last week with Republicans, it wouldn't have changed anything because they're not solving the problem. This is the problem. That's my rant. It's my Monday rant, and it kind of makes me mad because it's a simple solution and they're not doing it right. Providers need to compete on outcomes.